What is ulcerative colitis? Ulcerative colitis is a chronic condition characterized by inflammation and sores or ulcers in the rectum and colon or large intestine. Ulcerative colitis can be distinguished based on how much of the large intestine is involved. When ulcerative colitis involves only the rectum, it is referred to as proctitis. If the left side of the colon is involved, it is known as left-sided colitis. When the entire colon is involved, it is known as pancolitis. What is ulcerative colitis? Ulcerative colitis is a chronic condition characterized by inflammation and sores or ulcers in the rectum and colon or large intestine. Ulcerative colitis can be distinguished based on how much of the large intestine is involved. When ulcerative colitis involves only the rectum, it is referred to as proctitis. If the left side of the colon is involved, it is known as left-sided colitis. When the entire colon is involved, it is known as pancolitis. Ulcerative colitis is characterized by periods of time with active inflammation when the patient is experiencing symptoms, and periods of time when the inflammation is turned off and the patient feels well. We call these periods of wellness remission. Many patients with ulcerative colitis have long periods of remission, alternating with periods of active inflammation, which are called flares. Some patients with ulcerative colitis have more severe flares than others. Although the cause of ulcerative colitis is not known, many factors can contribute to a person's risk of having ulcerative colitis, but most can be thought of in three categories: genetic predisposition, environmental factors, and a dysregulated immune response in the GI tract, which causes the inflammation. Environmental factors may include infections, smoking, and taking antibiotics or non-steroidal anti-inflammatory drugs, or NSAIDs. In ulcerative colitis, inflammation appears within the colon, and the immune system works to combat the bacteria and viruses as it does with a cut on the surface of the skin. However, the difference is that the immune system is not able to turn itself off after it rids the body of the bacteria or viruses, so the ulcers remain until they are treated with medicine or surgery. This chronic inflammation is what causes the symptoms of ulcerative colitis. Periods of time with active inflammation when the patient is experiencing symptoms, and periods of time when the inflammation is turned off and the patient feels well. We call these periods of wellness remission. Many patients with ulcerative colitis have long periods of remission, alternating with periods of active inflammation, which are called flares. Some patients with ulcerative colitis have more
Ulcerative colitis is a type of inflammatory bowel disease, IBD, that affects the lining of the large intestine, colon, and rectum. Ulcerative colitis symptoms. The symptoms vary in severity and may start slowly or suddenly. About half of people only have mild symptoms. Others have more severe attacks that occur more often. Many factors can lead to attacks, including respiratory infections or physical stress. Symptoms include abdominal pain and cramping, abdominal sounds, a gurgling or splashing sound heard over the intestine, blood and pus in the stools, diarrhea from only a few episodes to very often, fever, tenesmus, rectal pain, weight loss. Children's growth may slow. Other symptoms that may occur with ulcerative colitis include the following: gastrointestinal vomiting, skin lumps or ulcers, ulcerative colitis treatment. The goals of treatment are to control the acute attacks, prevent repeated attacks, help the colon heal. Hospitalization is often needed for severe attacks. Your doctor may prescribe corticosteroids to reduce inflammation. You may be given nutrients through a vein, intravenous line. Diet and nutrition. Certain types of foods may worsen diarrhea and gas symptoms, especially during times of active disease. Diet suggestions include: eat small amounts of food throughout the day. Drink plenty of water. Drink small amounts throughout the day. Avoid high-fiber foods, bran, beans, nuts, seeds, and popcorn. Avoid fatty, greasy, or fried foods and sauces, butter, margarine, and heavy cream. Limit milk products if you are lactose intolerant. Dairy products are a good source of protein and calcium. Stress. You may feel worried, embarrassed, or even sad or depressed about having a bowel accident. Other stressful events in your life, such as moving or losing a job or a loved one, can cause digestive problems. Ask your doctor or nurse for tips on how to manage your stress. Medications. Medications that may be used to decrease the number of attacks include 5-aminosalicylates such as salaminosulfazine, which can help control moderate symptoms. Immunomodulators such as azathioprine and 6-mercaptopurine. Corticosteroids, prednisolone and methylprednisolone, taken by mouth during a flare-up or as a rectal suppository, foam, or enema. Infliximab, Remicade, or other biological treatments if you do not respond to other medications. Surgery. Surgery to remove the colon will cure ulcerative colitis and remove the threat of colon cancer. Surgery is usually recommended for patients with colitis that does not respond to complete medical therapy. Changes in the lining of the colon that are thought to be precancerous. Serious complications such as rupture, perforation of the colon, severe bleeding, hemorrhage, or toxic colon. Most of the time, the entire colon, including the rectum, is removed. Afterwards, patients may need a surgical opening in the abdominal wall, ileostomy, or a procedure that connects the small intestine to the ends to help the patient gain more normal bowel function. Ulcerative colitis is a common disease, yet every individual needs unique treatment and care. We encourage people with ulcerative colitis and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about ulcerative colitis and how